One of the first things you want to do is make sure that you have a good connection to your seat. So you want to make sure that your sit bones are connected and that you feel snug. So I always take the flesh and I kind of move it out of the way, and then I get myself snugly connected to the sit bones here in the seat. You also want to check that your seat is neither too close nor too far away. When you're too far away, it's really hard to get good leg drive. And when you're too close, it's going to be really hard on your hip flexors. I also want you to start paying attention to and looking at your alignment. So what I'm talking about here is the alignment from your ankle to your knee to your hip. And you really want to have the hip joint properly aligned with the ankle and the knee. And so some of the common things that happen when people are leaning left, or what happens, why the AMA gets buried and why they're leaning left, is this right leg is folded in or bent inwards, and the left one also, and a lot of weight is put through the left glute. Now, that is incredibly difficult on this hip socket when you're trying to paddle on the right side, and it's really hard on the left hip socket when you're paddling on the left side. So I want you to start being aware of what your ankle, knee, hip alignment is, and start paying attention to it so that when you catch yourself with your right knee over to the left, because it's going to happen, that's normal. When you catch yourself doing that you can remind yourself to move it out and also to bring the left one in alignment too. So you want to pay attention to that ankle, knee, hip alignment and catch yourself as often as you can and bring yourself back to center. Notice your pelvis and your pelvic alignment, and it's really helpful if you can start to pay attention to when you've twisted or started to pull your back or your pelvis around. This puts a ton of pressure on your sacrum and it really causes a shift or a twist in your pelvis. So if you can start to pay attention to what your actual pelvis is doing and try to bring yourself back to center as often as possible, that's not only going to help with the AMA weight or the stability of the canoe, it's also going to really help keep your back and your hips healthy for paddling. And with the weight on the AMA, what you can start to do is pay attention to how much weight you're actually putting through the right hip or through the right sit bone, and start to give yourself a challenge of putting more weight through the right and a little bit less through the left. Again, it's really common to sit with all your weight over here, especially when we're first getting started and when we've built this habit over years, right? We want to get into the habit of checking on our pelvis, checking on our ankle, knee, hip alignment, and making sure that we're putting weight through the right sit bone and not leaning on or heavily favoring or compressing down onto the left side. So these are some tips that should help you find a proper alignment and proper position for your lower body in the OC1.